Thank you very much to Ntokozo Khumalo for that business update. Let's bring you this now. Various groups say South Africa has dropped the ball when it comes to managing the spread of HIV. This is despite strides made to get those infected on treatment and advances with medication. Here's Ziniko Mhlaba with that report.
South Africa still has the highest prevalence of HIV and AIDS globally. Billions have been spent on getting those infected on antiretroviral drugs.
On the HIV front, I would say we actually, when we measure programmatically, we've got what we call incidence and prevalence. So prevalence really measures the issue around how prevalent is HIV within our communities. So in the past, you probably would have a situation where incidence was very high. These are new transmissions, these are new infections. So getting much more infections happening rapidly, but prevalence as well now dropping because people were dying. Now the kind of medicines that we have in ARVs are more efficacious.
But statistics show that over 1 million HIV positive people aren't taking their medication despite knowing their status.
In terms of the numbers, actual numbers, raw numbers, we still have to find about 1.1 million patients that know their HIV status but have to be put on treatment. So it's just having to work with our communities to find them and put them on treatment.
Infections amongst youth remain a major concern.
The young people who are getting infected with HIV currently are falling within the same group that we were able as a country to prevent them from contracting HIV before they were born. We were able as a country to prevent them from contracting HIV before we were born. And as the time goes by, we lost it along the way because the same people who are getting new HIV infections now are falling within the same category.
The Treatment Action Campaign says the country needs to reflect.
We must ask ourselves as the country, what are the issues? There are a lot of dynamics related to the HIV prevention, the spread of HIV, and some of these dynamics are informed by the socio-economic conditions of our people, more especially the Black people, taking into consideration our historical background as well as our material conditions.
Statistics show that 237,000 new infections were recorded in 2023 alone, with 46,000 patients starting treatment late. For Newzroom Afrika on Channel 405, I'm Ziniko Mhlaba in Johannesburg.